Thank you for watching another episode of Wednesday Wellness with Leora. I'm Leora Acoca Goldberg. I'm an exercise physiologist, holistic nutritionist, and a wellness advocate. Tonight with me are two experts, Dr. Randall Feingold. He is the co-founder of New York Breast Reconstruction and Aesthetic Plastic Surgery. He's a member of ASPS, which is a patient safety committee investigating breast implant illness. He has earned numerous patient awards by the American Cancer Society over the years for his contribution and leadership in this field. And our guest, Dr. Gerry Curatola, who is the father of modern biological dentistry. He's an educator, a professor at NYU, and the author of the book, Your Mouth-Body Connection. Thank you both for being here tonight. We're going to talk about the connection between oral health and our immune system. This is especially important for women who are suffering from overload of toxicity, autoimmune issues. Dr. Gerry Curatola, the big question is, what is biological dentistry?
So that's interesting because most dentists don't even know what biological dentistry is. So it's a great question to start with. Biological dentistry is actually rooted in biological medicine. Biological medicine really was a movement in Germany and Switzerland that was focused on looking at the body as this integrative system that really encompasses a microbial, bioenergetic, chemical, psycho-emotional, and spiritual components of the person. And that ability, the unique ability of the body to self-regulate and heal. That regulation and healing is made possible because of what we call the biological field, which is really a fancy word for the spiritual component of the person, the ethereal body, which is not a cliche. When we say mind, body, spirit, it's real. So I travels down the rabbit hole of biological medicine really started about 35 years ago. And it took me to Germany and Switzerland with a Dr. Thomas Rau, who is a renowned medical doctor, who was reversing all kinds of chronic illness, including the big C, cancer. I had patients who went to him with breast cancer, prostate cancer, autoimmune disease, lung cancer, you name it. And they were being treated by him without chemotherapy and radiation. And that was very fascinating. But the unique thing about Dr. Rau is if you had any of those illnesses I just mentioned, the first thing he would say is, open your mouth. Do you have root canals? Do you have heavy metals? Did you have your wisdom teeth taken out? And you have a jaw cavitation? Do you have teeth with microplastics? Do you have metal fillings? Do you have gum disease? These are all sources, and gum disease is the biggest, of chronic low-grade inflammation and toxicity.
Was he a dentist by training?
No, he was an MD, which was fascinating to me because I come from a family of MDs. My brother told me, I was just with my brother last week, and he said to me, when I was in medical school, I think we spent 3 days on the mouth. And so there was this big disconnect between medicine and dentistry that was unusual. Prior to my travels to Switzerland and Germany, I got a notification in my office. It was around 1998, and Harvard Medical School was doing a program in complementary and alternative medicine. It was 2 summers in a row, and it was open, said open to all healthcare professionals. So I've always gravitated to wanting to feel like your mouth is connected to this. And sure enough, I'm there the first day. The guy sitting next to me is a nice MD, and he goes, hey, I'm Bob so-and-so. I said, hi, Bob, I'm Gerry Curatola. He goes, hey, Gerry. And he goes, what do you do? And I said, oh, I'm a dentist. And he looks at me and he goes, what are you doing here? Because I was in Harvard Medical School. And I said, Bob, the mouth is not really disconnected from the rest of you. And as a matter of fact, 90% of toxicity and inflammation in the body is in your mouth. And gum disease, which is epidemic over its estimates, if you go to the Colgate toothpaste website, it says over 80%, but it's 80 to 90% of the American adult public has periodontal disease, which is gum disease, which is a silent killer. It doesn't hurt. People tell me, oh, my gums bleed when I brush, but I guess I'm brushing too hard. And I tell them, if you were brushing your scalp and your scalp was bleeding, do you think you were brushing too hard? I said, it's a sign of inflammation. And that inflammation causes a cascade of events in the whole body. And one of the biggest sources of inflammation that I've come across besides the mouth are breast implants, or can be a source of chronic inflammation.
A couple of comments. First, with regard to this Dr. Rao, that I guess was a role model for you or a mentor to you, or someone who
Yes.
introduced you to a certain way of thinking. There must have been some evolution in his career as a
Yes.
medical doctor to have such a primary concern or focus on oral health when evaluating people with different conditions. Maybe you can say a little bit more.
Yeah. That's a great.
What his career, the journey of his career, because that's a pretty big evolution for most of us who went to medical school in terms of that focus. And another comment I would make when you talk about the mouth being a focus of inflammation or sepsis, the mouth certainly isn't the only part of the body that can generate that. As a surgical resident, taking care on the vascular surgery service of diabetics who had, say, poor blood flow, low-grade infection of toes, feet, etc. They often had altered personality, affect, mental status, not always full-blown sepsis, but they definitely had systemic change. And then when you treated them, sometimes with medicine, but unfortunately for many of them, surgery to remove gangrenous parts, they had dramatic personality turnarounds, and their affect and their level of alertness, their intellect, their happiness. There's no question that if any part of your body has some smoldering infection or sepsis going on, it's going to
I
have
couldn't agree more.
total body impact.
Yeah, I couldn't agree more. And what you're saying is so true. And that I've, in my 42 years of practice, that I've seen people with molar abscesses and all kinds of dental infections. And it affects them in such a profound way, because we used to think, oh, it's a tooth. How does that connect? And there was a man by the name of Dr. Weston Price. He was a dentist, and he wrote the book on nutrition and physical degeneration, which was, now it's recognized as a seminal work. He was like the Charles Darwin of nutrition. And he talked about how he was the first. The book, by the way, came out in the 1930s. And he talked about the relationship of mouth infection to systemic disease. In 1913, he lectured, in 1917, he lectured to the St. Louis Dental Society on the relationship of mouth infection to systemic disease, and they laughed at him. They scoffed him. How could something in the mouth cause a problem somewhere else? So he did these experiments, besides his great work in anthropological work with nutrition and studying primitive cultures that had more primitive diets, that had beautiful, fully formed jaws. And then he looked at cultures with more civilized diets and the introduction of more processed and refined foods, that there were all kinds of jaw malformations. And so he postulated what we now know is indeed possible, that this epigenetic issue of that you can damage your genes with a condition, a chronic infection, a chronic inflammation. And now we know, certainly we see the fact that people who have chronic inflammation, it alters the expression of their genes, and you get the advent of tumorigenesis and all these other things. So his work, Weston Price, was very profound, and most dentists never heard of him. There should be, he founded the research arm of the American Dental Association. He did a tremendous amount of work. But in his book, Nutrition and Physical Degeneration, he talks about how disease in the body not only affects the quality of life for that person, but it can damage genes and affect the expression of those genes in subsequent generations as well.
Leora, how did you come to get to know Dr. Curatola? And what are the kind of links that you see between the patients that we take care of and
Great question.
Dr. Curatola's specialty?
Let's start with getting to know you first, Dr. Feingold. I think that on my journey to health and wellness, always seeking to look good. I'm a former Miss Israel. I'm also a nutritionist and an exercise physiologist. So it's all connected, and I wanted to look and feel good. But when I came to you in 2021, I had concern about my breast implants because I had a constellation of symptoms that were unexplained, like tingling in my hands, not breathing properly, brain fog sometimes. I think that at some point there were about 20 symptoms, but they were weird. It's not like I was diagnosed with anything. I was lucky to meet Dr. Randall Feingold, and I removed my breast implants, and Dr. Randall Feingold sent them to pathology, so everything came negative. I didn't have any pathogen, no mold. And what happened was that probably 3-4 months after explanting, I started getting infection in my gum, where I had root canals, actually. At some point, I removed them, and I put implants, that it did not really agree with me. Later on, I understood it was a metal in my mouth. But when the doctor, a traditional doctor in New York City, when he checked, he didn't take any biopsy of the area to see what kind of infection I had. And I started thinking that I may have parasites, mold, because I was exposed to it a few years ago. At some point, I said, okay, this time I'm going to a biodentist because it was really important for me not to put any more toxins in my body. And I walked into Dr. Gerry Curatola, and there was a really good chemistry. And right away, he said to me, come and let me test you. So I don't know how you call that machine, Dr. Curatola.
Cone beam, CBCT, cone beam computerized tomography. It's a
Yes.
3D radiographic scan of the jaw.
And this is where I looked together with him at my results and my cavitation, especially on teeth 3 and 14, which actually are the teeth that correlate to breast health and stomach.
Right there. Yep.
Issues were infected, and he said you have to take it right away. When Dr. Curatola tested my root canals, I came positive to Lyme disease, mold, yeast, and parasites. This is where I started understanding that there is a relationship between my mouth and my systemic overall symptoms that I would have. And since we start cleaning up and removing all of the things that caused infection, my gums are totally healthy.
Yeah, you know what's interesting is that the body wants to heal. A lot of people really don't understand that. They think, and it's often, I see people who had lots of dental work over the years, and probably the worst medical procedure and dental procedure probably ever developed was modern root canal therapy. When I came out of dental school in 1983, I thought, oh, root canals are wonderful. We do this roto-rooter on the tooth and we save the tooth, thinking that the tooth is this inert thing. And it's funny because when I first came out of dental school, they were using a paste in root canal treatment. It was called Sargenti paste, and it had formaldehyde in it. So they were literally embalming the tooth. Most people believe the tooth is just a thing that sits in the bone, and as long as the bone is healthy, everything's groovy. To begin with, you cannot keep anything dead in the human body, whether it's your gallbladder, your appendix, a femur. We don't do root canals on any of those, but doing a root canal on a tooth was thought to be okay because it was kind of isolated and by itself. In fact, in many systems of medicine, including Chinese medicine, they see the tooth as a living, breathing organ that has an energetic connection on a meridian for all different parts of the body. For example, your upper molars are connected energetically to the breast. You have the stomach, the pancreas on the upper right, and the spleen on the upper left, and the thyroid. I had a woman who came in to my office. They were doing a scan on her like you had, Leora, a 3D scan. And she had 3 root canals, 2 on the upper right and 1 on the upper left. The 2 on the upper right were abscessed, and they had actually, the abscess had eaten in through the wall of the sinus cavity, and the infection had spread into her sinus, and half of her sinus was congested and filled with junk. On the other side, she had a root canal that was beginning to abscess, but it hadn't perforated the sinus. I happened to walk by the room where her scan was up, and the first thing I said is, do you have any problems with your breasts? And she looked at me like a deer in the headlights, and she said, I just had a double mastectomy and slung kettering. So sorry, I didn't look at your history, and She was coming in to get cosmetic damage. She was coming in to get veneers on her front teeth. That was her, actually, ironically, her reward for what she had been through with fighting breast cancer. I said, these infections are still here. And you have to understand that the body regulates and dysregulates on a lot of different levels. Microbially, biochemically, for example, a lot of people with root canals, all of a sudden I start to see thyroid dysregulation. How the heck did that happen? And you would say, oh, that's anecdotal and yada, yada. You see it enough times that it all starts to make sense, that the mouth and the body are intimately connected, and that dental infection, not just in the mouth, even though that's a very common place, but in every area of the body. You know, what's interesting is that infection, like gum infections, often they're painless. They don't hurt. Like I said, people see bleeding gums, or they have bad breath, or they see their teeth are moving, but they really don't connect it as, and like a sepsis, where you have a fever, you have other types of symptoms that are affecting the patient systemically as well. A lot of times in the mouth, there's stealth infections. Root canals don't hurt. This woman was in no pain with the root canals. The nerves of the teeth were removed, and she had no pain at all. She looked at me, by the way. The sad part of this is that I think I scared the hell out of her, and she wasn't open to hearing what I was sharing. I said, which side was the breast cancer on? The side where the infection had eaten through the sinus. The other side, her breast was all cystic, so they were recommending a double mastectomy.
I do agree that infection can be silent, infection can be occult. And in my specialty, where women have concerns about breast implant safety, and we look at the microbiome or biofilm on their implants and in their capsules, sometimes there's no bacteria or fungus or yeast. Sometimes there is. Maybe a third of my capsule specimens from explants have bacteria of different types, some of which are more classically pathogenic and some thought not to be. But it just raises ideas in my mind that when women have systemic symptoms and they get better when you take out their implants with their capsules, that maybe there is some burden from colonization by different organisms that, while not in the form of a classic infection, is causing a systemic effect. And that's why I do study all of my patients. And if they have symptoms and if they have colonies of uncommon bacteria, consider therapy for that beyond their surgery. But I'm still trying to figure out the association between dental health and breast health, to the extent that it's probably a truism that if any one area of the body is diseased, it's going to make the whole body sick. So I don't know if in your dental practice you have patients with a greater degree of breast complaints, or Leora, if you find talking to patients that a lot of our symptomatic breast patients have dental concerns. So I don't know if you can.
Well, I'm getting women that send me messages on Instagram, on Facebook, and they will share with me that they have breast implant illness. And I will ask them, have a started question, have you done MRI, mammography? Do you have any root canals? Do you have any crowns, implants? Because I think that Dr. Feingold, you mentioned it in one of our podcasts, that there are many stressors to the body. So obviously not every woman that has root canal will have cancer. But I saw some of the research on cancer, the link between cancers and root canal. And also there are studies now that are showing connection with autoimmune diseases, symptoms that are occurring because of inflammation of the mouth. So I think that's maybe a question we should ask. To me, it's really about raising awareness in the wellness community to say you have to look into this too, because it's a silent infection. And by the way, I just discovered that today, that there is a nerve that runs all the way from the mouth and the jaw to the brain. And when you have infection in the cavities, it's actually affecting and it's causing brain fog. And Dr. Randall Feingold, we know that brain fog is like one of the most common symptoms in breast implant illness. So there must be a connection. The breast is here, the mouth is here, it's very connected to the lymphatic system. I don't know, any thought about that?
When I evaluate patients with systemic symptoms, and they're concerned it may have something to do with their breast implants, and they have many symptoms. Some of them are quite similar, but they're not fitting a classical diagnosis,
Yeah.
I'm not quick to operate on somebody unless we figure out whether they have some other treatable cause, because we don't want to overlook that. And we typically think about rheumatologic evaluation, endocrine evaluation, infectious disease evaluation, so that I'm not doing explant surgery on somebody with an unrecognized thyroid condition or adrenal condition, or untreated Lyme disease, for example, or Epstein-Barr. So do you think that I should add more of a focus when I see my patients into inquiring about their dental health to make sure I'm not missing a bigger culprit there that may not be the cause of their symptoms, but maybe it's part of their problem, and everybody we explant doesn't instantly get better. Many do, but some don't.
Yeah, no, I think there's a confluence of factors that affects the body's ability to regulate and heal. And that's the big thing, is this dysregulation that occurs. And I'm glad you used the word stressors, because there are a lot of stressors. Somebody could be walking around with an infected root canal for 20 years and they don't even know it, and there are no symptoms. And the dentist, the general dentist, takes an x-ray. By the way, the CBCT is a 3D. When I teach this, 2D versus 3D, it's a game changer. And as a matter of fact, you'll hear this word, jaw cavitation. You may have heard it, but it really now is a major focus, because we used to think when you pull out a tooth, oh, the gums grow over and the dentist scrapes around a little bit in the osseous, in the socket, and then the gums grow over and the bone fills in and everything's groovy. And the reality is that what we know now is that bone regeneration, especially in the mandible and the maxilla, is very interesting. There's a constant deposition of new bone and resorption of old bone. And if you don't graft a dental socket after a tooth is removed, the gums will grow over and you get a thin shell of bone, but then you're left with this necrotic area where it's warm, it's dark, it's moist, and there isn't a good blood supply. It's really necrotic bone. So we call it jaw osteonecrosis or cavitational osteonecrosis. The problem with that is that this necrotic area becomes a source of low-grade inflammation, but then it's also a petri dish for pathogens. And by the way, I tell people your teeth are like circuit breakers of the body's electrical system. It's like a panel box. And so you'll have a jaw cavitation, and it's on the meridian for the pericardium of the heart, and it's also on the meridian for the small intestine. So I will have many patients, many young patients who have their wisdom teeth taken out between the ages of 16 and 20. And at 23 years old, they're diagnosed with leaky gut, or they have an MVP, a mitral valve prolapse, or an extra heartbeat. And I had a woman who had come to me who's huge exercise fitness influencer, 32 years old. She's on her second pacemaker, and she had the worst gut problem. And it's always like she's swimming upstream. And when I did the CBCT, which is the 3D, you would never see that jaw cavitation 2D, because you have dense cortical bone here and dense cortical bone on the inside of the mandible, the lingual side here, and where my head is the jaw cavitation. But on a 2D, it's all superimposed. On a 3D, we could take slices and look from everywhere. When I did her CAT scan, they looked like black grapes in her jaw that she had been living with probably 6 months after the wisdom teeth were extracted. Those formed. Thankfully, does she have cancer? No. Does she have this? No. But this is a woman who was struggling with the exact symptoms that were correlating to the meridian that is regulating her immune system related to that particular part of the body. There was a movie that was done by an Australian producer. It was his personal story about having a root canal on a front tooth and this whole sequela of events he went through. He broke up a fight between a guy and his girlfriend on a beach, and he got punched in the mouth. And it caused him to need a root canal. And he went through all of these symptoms. The name of the movie was called The Root Cause. And he had all kinds of doctors on both sides talking about how that could be possible. That stressor of that root canal on that front tooth could be causing his depression and this and all these other things. When he had the root canal tooth out, they all went away. And it made him really, it compelled him to write the script and do the movie. And it was on Netflix and it was on Amazon. And then the American Association of Endodontists, who are responsible for performing the organization, the body behind the endodontists of America, who perform 28 million root canals at about $2,500 a pop average. And then you times 2,500 times 25 million. I can't even do how many zeros that is. They filed a class action lawsuit that said that it was scaring the public. It wasn't in the public interest. And they all caved and pulled it down. It was actually a well done docudrama about what I have witnessed as a dentist. And I can put my hand on a stack of Bibles of seeing how people's illness goes into remission when you remove the stressors. So I would ask you, when you remove the stressor of a breast implant that's causing this adverse reaction, and it's not, of course, it's not every patient walking around with a root canal needs their root canal removed, and not every patient who has breast implants needs their breast implants removed. But the people that are suffering, when you take them out, what are some of the dramatic experiences you've seen, Randy?
There's just a whole host of changes in some patients related to their brain fog and visual disturbances and migraines and hair loss and skin changes and joint pain and dependency on certain medications or biologic infusions for joint or pulmonary conditions. It's really a very long list of observations, and it may very well go to removing a inflammatory source or an infectious source or something provoking an autoimmune reaction that sends other transmitters through the body and gives unintended secondary consequences away from the primary inflammatory site. How do you do things differently with this knowledge compared to 30 years ago?
Thank you for asking that, because that's a terrific question. First thing that I teach students is I tell them that biologic dentistry is not voodoo. It is not, we don't do state of the art or standard of care in dentistry. We're just more conscious of the materials that we're using and also more conscious of how we manage those materials in the mouth. For example, when a dentist takes a drill onto an old silver colored filling, which is a dental amalgam, which is 52% mercury, it's 26% silver. So really, I've always had a bug, and I've had this bug for a while now, that a dentist who calls a silver colored filling a silver filling is really a fraudulent misrepresentation to the patient. Saying, Susie, we're going to do a silver filling on an upper molar because it's in the back and you're not going to see it, is different than saying, Susie, we're going to put a mercury filling in a back upper molar because you don't see it. Susie's going to have a bigger problem hearing that it's 52% mercury. So most patients are unaware. However, when a dentist takes a drill to a dental amalgam, it creates an invisible cloud of mercury vapor, which, by the way, there's videos on YouTube called The Smoking Tooth and all that about how the off-gassing of methylmercury and mercury vapor from silver-colored fillings. If you grind your teeth, you drink hot liquids and things like that comes off. But the worst amount of mercury exposure is when you stick a drill to take out an old filling that has decay under it, and you go around. The mercury vapor that comes off that tooth will raise the level of unsafe levels of mercury vapor in a dental office that OSHA would shut that office down if it went into the dental office with a mercury vapor analyzer, which they never do.
Sounds like if you're going to go back and handle these materials in the mouth, you're making me feel like it's like you got to treat it like an asbestos abatement, where you do some kind of a containment methodology. The act of removing it isn't causing harm in its own right.
No, you're absolutely right. And the thing is that I've been on the faculty of NYU College of Dentistry for probably 38 years. And we managed with with the chairman of the restorative department there, Mark Wolf, who's now the dean of the College of Dentistry at University of Pennsylvania. We both had a bug about amalgam. Like, why the hell are we using this shit with 51%, 52% mercury and sticking it in little kids' heads 2 inches from their developing brain? It's barbaric. And the reason is it's cheap, it's easy to do, and literally you need no skill to put it in. A monkey can put it in.
Is it still standard of care?
Yes. Yes. And by the way, the American Dental Association was founded in the late 1800s, 1860s, 1868, right after the Civil War. They introduced dental amalgam then. And there was a battle between the dentists who were pro-mercury, anti-mercury, and the pro-amalgam or pro-mercury dentists won, and they formed the American Dental Association. The American Dental Association had the first patent on dental amalgam. So they don't react that much differently. And at my stage of the game, and I've been a card-carrying member of the American Dental Association for my entire career, and I'm very supportive of organized dentistry, but I think dentistry needs to change. It's in the dark ages. It is not, and we need to own up to a lot of things like fluoride in the water. Everyone thinks fluoride in the water, oh, it prevents cavities. And no, the World Health Organization had a very interesting statistic and chart that showed most of Western Europe, by the way, was never fluoridated. And decay rates from 1970 to 2010, the decay rates declining, and they compared fluoridated countries and non-fluoridated countries. And the decay rates declined at exactly the same graph down. And it's really a startling graph that putting fluoride in the water had nothing to do with it. Fluoride in the water doesn't work. It doesn't make your teeth stronger, harder, or anything. Most of it is a really nasty chemical, hydrofluorosilicic acid. We buy it. It's a hazardous waste product. They have to wear hazmat suits to dump it into the Catskill reservoirs. And it has done nothing for decay. And it is over 81 studies linking it to cognitive decline in children. Over 21 studies linking it to osteoporosis and the interference of proper bone metabolism. There are studies that showed Harvard University School of Public Health showed a statistical correlation between children drinking fluoridated water, especially in boys between the ages of 7 and 11 when their growth endings of their bones are most active, osteosarcoma in male children between the ages of 7 and 11. There is no benefit from it. So why the hell are we putting a toxic waste product into the water supply? It used to be put, by the way, a little history, it used to be put in drums then, and that it would eat through the drums. There was a story on the news a couple of years back about a fluoride spill at a water treatment plant. I forget where it was, a fluoride spill where the fluoride was corroding the concrete. That's how corrosive it is. So under the guise of preventative dentistry, with studies that were done in the late 1940s with no controls, there's never been one randomized, double-blind, controlled clinical trial showing the safety or efficacy of dental fluoride. Why are we still putting it in the water? Because there are 3 companies that make this hazardous waste. One of them is aluminum manufacturing, which is Alcoa. One of them is phosphate fertilizer industry. That's Monsanto. They're also the heroes of making, Roundup and all that. That is a source of class action lawsuits. And the other one is the Department of Defense, because it's a byproduct of uranium enrichment. So we have this stuff that we dump in the water under the guise of preventative dentistry when most of Western Europe didn't. And by the way, do you want to know why Western Europe never put fluoride in the water? Because after the Nuremberg trials, it was considered a drug, and it was mass drugging an entire population without their consent. And that is why it was not allowed. So if you want to put fluoride in your kid's teeth, and you think, by the way, fluoride, which fluorine is the element on the periodic table, it's the most highly negatively charged element on the periodic table that's not radioactive. So when you introduce it into the body, teeth and bones, which are made of hydroxyapatite, it blows out the hydroxy and it makes a mineral called fluorapatite, which is very hard, but 30% more brittle. which is why hip fracture rates in the 1980s, when they wanted to see, oh, we've been fluoridating for 30 years or whatever, let's see what's going on with hip fractures. And New England Journal of Medicine, Journal of the American Medical Association showed a exact exponential increase in hip fracture rates with the advent of fluoridating the water supply. But it's still being taught, it's still being propagated. This is, what in biologic dentistry, what I deal with. And people are like, oh, you're a radical, you're this and that. No, I'm not. I support organized dentistry. I support dental research, and I support good dentistry. And dentistry needs to pivot and shift. We need to come up with better. Instead of root canal, we need to do pulpal regenesis. We're actually using stem cells to grow teeth now. We're actually finally, and Japan is starting human trials on placing stem cells in the jaw. They've done it in animals, placing stem cells in the jaw that develop into a new tooth. This is regenerative medicine. This is our future. And this is the direction that dentistry needs to go.
Very interesting comments in there. In terms of parallels in our specialty, there are certainly concerns about material science as it relates to the development of breast implants and whether or not it poses any risks to people, and if removing implants has beneficial effects on patients that have sensitivities or toxicities related to silicone, for example, or the microbiome that may exist around it. And maybe, when I evaluate patients that come in with unusual symptoms, I should add it to my list of investigative thoughts about, are we sure you're really healthy outside of the breast? Maybe it comes from there. So yeah, there may be relationships between the mouth and the breast, but I guess it's just that we're all just one organism, and we don't want to overlook the contribution of these factors into our symptoms or our illnesses.
Yeah, I couldn't agree with you more, Randy. And by the way, incidentally, we have on our intake sheets, we ask, do you have any breast implants? Have you had any hip replacements? Titanium, by the way, we could be on talking about things for a long time, but even the metal implants have been found to produce endotoxins, bacteria and bacterial byproducts. Metal dental implants have found there's corrosion. And what we've been observing, if any of the dentists who do dental implants, we've been observing a lot of inflammation around the top of the implant where the gum tissue is, and we call it peri-implantitis. And it's created a whole new revenue stream for periodontists, gum specialists, to treat that. But really what it is that the titanium metal, I remember I did my first implant in 1989, and it was called the Branimark implant. Perringbar Branimark is the father of modern dental implants. And I thought the body loves this. The bone grows around it, and oh, wow, this is fantastic. It's kind of like breast implants, right? When they first came out, silicone implants, they look so lifelike that patients were happy and everything, until we started to see what happened as things transpired down the road and the kind of inflammatory problems that some people had, both with dental implants and with breast implants. It's not the procedure, the reconstruction, the art of doing that. And I know you're one of the best, but it is about the materials that we're using and being more conscious and aware of the Hippocratic Oath of do no harm.
So actually, I have to say that because I went through both dental issues and breast implants, I really saw the similarities with everything. And an implant is an implant, and the body is going to react. And I actually had to remove a titanium implant because it caused infection and went into the bone. So I know it at firsthand. I want to take that conversation, because we are running out of time, just to the last question about integrating holistic practices for both of you, Dr. Randall Feingold. I know you've done it, but also you've done it, Dr. Curatola. And because the issue of follow-up of patient after they have explant or after they remove their root canal is always like they're left alone in the journey of healing. And there is and there should be a protocol. I know that Dr. Randall Feingold and myself, we have been supporting people during that process, giving information and education. But maybe both of you can talk a little bit. We'll end up with something good about all the holistic stuff that you can provide to help speed up the healing and the recovery process.
Randy, you want to go first?
You talk about not leaving patients alone after their procedures. My practice has its roots in breast reconstruction, and helping women with implant complications is an extension of that. And we don't say goodbye to our patients. Even when their surgeries appear successful, we follow them at annual intervals because you just don't know what's going to evolve down the road, and patients may not come forward if they develop subsequent symptoms or complications, and other doctors may not know what their history is and what they've been through. So we try to keep long-term relationships going with patients to monitor symptoms and make sure that they're staying as good as we were able to get them.
Exactly. They don't call you doctor. They just go on the Facebook groups and we get all the information. It's really interesting how they tell everything, they share everything. It's such a powerful, empowering thing for women because they can share safely information, and that's great. So we get all this information firsthand.
Yeah, and Randy, I can relate to what you're saying. In dentistry, I admire the fact that you build these supportive relationships with patients and follow them through the process, because there are things that are stressors. The word you used earlier, which is so true, is that there are stressors in the body. I'm always amazed at how many, for lack of a better word, how many hits the body can take before it starts to respond, and before it starts to respond in a negative way. And I'm equally amazed at the body's ability to self-regulate and heal. When you take out maybe an implant that was not agreeing with the patient, that was offensive, or maybe that patient had a compromised immune system to start with because of other stressors, like maybe she had upper molar root canals or gum disease or other sources of inflammation. But the point of the matter is that there's so many reasons why medicine and dentistry needs to work more closely together. And I think one of the reasons I was called into dentistry is to maybe help at this stage in my life, as I'm teaching the younger generation of dentists, to understand that dentists need to evolve. Because what happens is you'll ask, hey, do you have any root canals? Yeah, you should get those looked at by your dentist. They'll go to a regular dentist with a regular x-ray. You won't see a thing. And they'll go, oh, yeah, it looks fine. And that's exactly what happened to a patient of mine from Houston, Texas. She said, hey, my friend Lisa was diagnosed with lung cancer. And she has a lung tumor taking up 2/3 of her left lung. And what should I tell her to look for? So what's the one? And that's the one, by the way, you should have in your breast implant screenings is, have you had any root canals? So what did she have? She had one root canal in her whole mouth, right? Where was it? I said, tell me where it was. Tooth number 19. What's tooth number 19 on? It's the meridian right below it for the lungs, for the left lung. Number 19 is the left lung and the colon. Lung and the colon are the same meridian.
This has all been very enlightening to me, and thank you for speaking with us tonight.
Yeah.
Certainly when I see patients with unexplained symptoms and they're worried about their breast implants because they're aware that they've got chronic embedded materials, I'm going to be more aware that it may not be the only depot of chronic material, foreign material embedded in the body that could be causing their symptoms. And I suspect many of them would want to learn a little bit more about what you're talking about, what your concerns are. Thank you for educating me on this. And Leora, thank you for connecting us this evening.
Thank you, guys. I want to thank both of you for being here. And we're all here for a good reason, to raise awareness and empower women on their journey to wellness. So thank you, Dr. Curatola. Thank you, Dr. Feingold.